Okay. Michael Baca Atlas.
Ready to roll.
Are you ready?
Always.
Hi there. Welcome to the Governor's Institute's Addiction Medicine Podcast. I'm Pauline Williamson, Director of Physician and Advanced Practice Provider Initiatives at the Governor's Institute. In today's episode, we want to share some information about the North Carolina Society of Addiction Medicine, what it is, the perks of membership, what they're working on, and how to get involved. Joining me today is Dr. Michael Baca Atlas, a family physician and addiction medicine specialist who has been involved in the North Carolina Society of Addiction Medicine since his residency and is the current president of the North Carolina chapter. Welcome, Dr. Baca Atlas.
Thanks, Pauline. You know I've told you like bajillion times to just call me Michael, and actually I prefer El Presidente instead.
All right, Michael. I want to start off by asking you to share a little bit about your journey to addiction medicine and why working with this patient population is meaningful to you.
Pauline, it's really interesting. I had absolutely no plans to really be doing this specific work and kind of be in this role in any capacity for the North Carolina Society of Addiction Medicine or even being board certified in addiction medicine. I actually came across it through my residency training in family medicine and saw here in North Carolina that just the care that our patients were receiving was really pretty terrible and really, in my opinion, just unacceptable. And this was probably a decade ago now. And it was particularly on our hospital service where we literally had people come in for services and they left with no treatment, no pharmacotherapy, no counseling, no other interventions. And it really honestly made me sick and felt like there was something that needed to be done. And so was fortunate that I was able to take part in the UNC Addiction Medicine Fellowship when it first started. And not to mention that I also have several family members with substance use disorders as well as co-occurring mental health disorders as well. So for me, I sort of feel right at home supporting and working with this population. But really it came from my residency training.
That's awesome. So what is this North Carolina Society of Addiction Medicine and how does membership work?
Well, really, it's a shadow organization. No, I'm just kidding. We are, first of all, we are the state chapter for ASAM, otherwise known as the American Society of Addiction Medicine. And this organization, for those that don't know, is really the largest leading professional society that's really actively trying to define and really expand the field. And I will say that it's very much a kind of physician presence. So I think it's important that, you know, we recognize that that's sort of ASAM's mission and focusing on that clinical population, particularly around like education, quality, advocacy. And they do a lot of guideline creation, which I think is really helpful for clinicians. And as a member of ASAM National, you automatically become a part of the greatest chapter in the entire United States, which is the North Carolina Society of Addiction Medicine. And really being a member provides you with access to our state-specific meetings, a lot of professional development programs, educational resources, and, you know, really just getting a better sense of what's happening in our state, I think, when it comes to addiction medicine treatment.
So who can join the society?
Everyone. No, there's a few different membership types. So there are physicians, early career physicians, and really emphasize like our trainees, residents, fellows, students for that matter. A lot of what are known as sort of associate members that sort of falls in line with RNs or registered nurses or my APP colleagues like PAs and NPs. And then certainly there's folks that are retired that can be a part. So really there's a pretty broad array of professionals that can be involved.
So I've been with the Governor's Institute for about 10 years now, and I have a vague memory of you during your residency actually attending our addiction medicine conference as one of our scholarship recipients. Am I remembering that correctly?
You might be. It was a time long ago. And I will say that, yeah, those kinds of offerings are, I think, what really can get people heavily involved. And so ever since then, it's been hard to be separated from the Governor's Institute.
Well, we're happy to continue our relationship with you. So sometimes people ask me if the Governor's Institute and the North Carolina Society of Addiction Medicine are the same thing. And now I think this is because members might see both of our names on emails and educational offerings. Can you help clarify the relationship between the two organizations?
I'm going to do my best here because at times I feel like sometimes we have such, really strong overlap and work together, but there are really some key differences. I think just kind of to define our working relationship, it really centers around our educational events that we host. But really, again, we are two separate organizations that really reminding us that the Governor's Institute is not a membership-based organization. It's non-governmental, nonprofit. Obviously, you know that, working for the Governor's Institute. And you all are focused really on the things like prevention and treatment and recovery from substance use disorders. On the flip side, NC-SAM is membership-based. And again, we're focused on high-quality addiction treatment, educating medical professionals, supporting research, prevention. And although we are separate organizations, I think that there is a lot of overlap. And I think when we think about education, that is a core thing that NC-SAM does. And I think what we've really tried to do over time is to really build a network where many of us are available for if people in other, like I think about more maybe rural settings or primary care settings that haven't had as much exposure or training can really reach out if they need us, and really kind of supporting people across the state with our expertise. And I think we have many of our members that are located across the entire state of North Carolina that are serving and working with different communities.
So we're separate organizations, we have similar goals, and I just wanted to tack on one little thing. The Governor's Institute is happy to work with NC-SAM. I think that we're uniquely positioned to assist NC-SAM with some of those administrative tasks that societies and organizations need. So happy to work with you all in that role.
I am going to make a small plug for Pollen Williamson, who just... Pollen, I think your ability to help us as an organization and kind of bridge not only the gaps with the Governor's Institute, but also all of the connections across the state, I am eternally grateful. And just putting in that's my disclosure today, is a Pollen Williamson disclosure.
Well, thank you. I appreciate it. So what are some of the perks of membership? If you join the North Carolina Society of Addiction Medicine, what are we looking at? I
mean, do we have like 2 or 3 hours to talk about all the perks? No, I'm just kidding. We have a couple benefits. So one of those is that I think people are looking for evidence-based research articles. So you do get free access to the Journal of Addiction Medicine, which I carry around with me everywhere for the most part. You can have access to sort of what's known as like an ASAM fellow designation. So just like other professional societies where you might be distinguished as a fellow for the American Academy of Family Physicians or for internal medicine or pediatrics. There's sort of this extra designation that kind of, I think, sort of can elevate one's status maybe a little bit in terms of recognition of your work and your expertise. Obviously, there are lots of different member-exclusive rates for different CME offerings, state chapter support, and a pretty big online community. And then there's also some access to the Career Center as well. So when you join as an ASAM member, you are automatically included as a member of your state chapter. So I think one of the greatest perks that I haven't mentioned yet is that, people get to hang out with me and also our officers and oftentimes the GI crew as well. But really, I think we're looking to, like anything, I think we're trying to reduce stigma for patients, but also just across clinicians as well. And I think I think we all kind of recognize that stigma is existing in many, many places. And I think for us to exist as kind of this network that can really be supporting others, I think it hopefully make a huge difference across the state.
Absolutely. So what is NC-SAM working on right now?
Lots and lots of different things, Pollen. Let's just take a dive into a few of these things. So really, I think what we really, are super focused on all the time is really the educational opportunities that are available for members and non-members as well. But we obviously work really closely with you all, developing what I think is medicine that is up to date, that is relevant, and it's not stuff from 15 years ago and 20 years ago, but we're really always trying to think about who are the brightest and the best, most relevant speakers across the country, or even obviously people in our own state doing amazing work. And that really spreads into 3 annual CME conferences that we do. So there's a spring conference, there is a June adolescent conference, and then we have an October virtual conference. So really feel like it's wonderful for like trainees and other folks that are really busy in clinical practice. If you miss one, don't worry. You got other opportunities throughout the rest of the year to attend some of these different offerings. One thing that I'm super excited, and we did, I think this was maybe pre-COVID, with our pre-conference at our statewide conference in Asheville, is we are bringing it back we're rolling it back, Pollen, and really excited to put this on. More details to come in the future, but really going to have more of like a specific population focus a day before our actual conference in the spring that I am super excited to work with you on and many others. And then we also have some other educational workshops. These are much smaller events. These are kind of like maybe one-off speakers or two speakers on specific topics. And we do that at our annual meeting, which typically occurs in June. And then this year, based on a meeting that you and I actually had pretty recently, we are going to look at maybe kind of November, December to bring another speaker in to really just make sure that across the board, people have opportunities to stay up to date and also ways that are feasible. We know that like doing stuff from like 8 to 4, pretty hard when you're working full time and busy with patient care. So want to make sure that we have virtual options, in-person options, and stuff that's going to work for different people's schedules.
So do you have anything other than the educational events going on?
No. Yes, we do. we have. So one area that's been, I think, really important in light of just a lot of different changing policies related to healthcare in general these days, I think we are really this year going to be beefing up what we're doing around advocacy, and specifically not just advocacy like for patients or for clinicians, but really advocacy at a policy level. And we know that good policy can make a tremendous difference for our patients, for many of us that are doing this work. And we, like, as of right now, we are putting together a group within the North Carolina Society of Addiction Medicine, and we are looking to recruit folks. So if people are listening and want to hang out with us, get in touch with us, really wanting to work collaboratively in this space to figure out, how are the best ways that we can work with even other professional organizations that are doing addiction or substance use disorder work, recognizing that this stuff is really a huge team effort. And we really want to make sure that our patients have access to evidence-based care, that they're receiving care in non-stigmatized ways, and that also, we're really kind of focused on moving forward the addiction landscape in North Carolina and staying really up to date. And we have, again, incredible resources in our state, our harm reduction coalitions, different drug checking organizations, just people that are really on the front lines. I think about my other colleagues that are peer supports or community health workers, like really making sure that policies are supporting lots of different working professionals and also our patients at the same time.
Absolutely. I think all of those organizations are very important, as well as focusing on students, residents, and fellows as they're coming out of school and out of their educational journey, I guess, and going into addiction medicine treatment. So if someone's interested, if they're listening today, how can they get involved? What should they be on the lookout for?
So we have I would say probably like a top 1 or 2 website in the entire country that has a lot of information about what we do and who we are, where you can get our contact information and reach out to us at any point. Essentially, you can contact any one of us officers or our chapter administrator, which I have not mentioned yet so far. No, just kidding, the Pollen Williamson. And our details can be found at ncsam-asam.org. Again, that's ncsam-asam.org. And I think, honestly, to me, one of the lowest hanging fruit to just get more involved is just to come to one of our events. That could be virtual, that could be in person. Like we said, many have multiple different options. Again, whether it's a hybrid event, just being able to come and I think, see all of us in person. Would love to get to meet anybody who's interested in getting more involved. And again, that could be just, getting more education at your home institution, whether that's a clinic, a hospital, an emergency room, or it's, getting some kind of consultation or even just a case consultation. If you have a challenging situation, we're always happy to kind of try to support in any way that we can our members, but also, again, folks that are new to this field. I think it's important that we're fostering the development of a really robust workforce, as I've said before. The only other thing I wanted to plug is you said before that about me being a student and getting connected to GI. And honestly, I probably wouldn't be here without attending and having a scholarship. So I can't stress enough for those students, residents, fellows out there. I think it's such a nice in to sort of get into this space, see what it's about. And even if it's not something that's, again, lifelong or like a future career path, I think just being able to get exposed to some of the different folks that are involved. And I think, for me, it was a game changer to be involved and have that opportunity.
And I'm so happy it was a game changer for you. We're happy to have you working in this space. So thank you so much for joining me, Michael, and thanks for the great work that you do every day to improve the lives of those that are living with addiction. So I'm going to wrap things up with our top takeaways. So it sounds like NCSAM is the state chapter of ASAM, the American Society of Addiction Medicine. The society is growing, it's becoming more active, and it's seeking to increase engagement with both existing and new members to enhance access to high-quality addiction treatment. And then to get involved, if you're interested, listeners can learn more at ncsam-asam.org. And be sure to register and attend the NCSAM-supported educational events. And the ones that Michael just mentioned, we're looking at the Spring Addiction Medicine Conference. That one's in person and virtual. The Adolescent Substance Use Disorder Conference. That one's virtual. The Fall Addiction Medicine Essentials Conference, which is also virtual. And then, of course, always everyone's welcome to come to the NCSAM annual meetings, which are virtual and held in June. So thank you so much again. If you enjoyed this episode or learned something new, be sure to subscribe to the Governor's Institute's Addiction Medicine podcast and share it with a friend or colleague. For more resources, visit governorsinstitute.org. Until next time, I'm Pauline Williamson, and this has been the Addiction Medicine Podcast. Thanks for listening.